Hey everyone, this is Dr. Zach Greenway here, Performance Sport and Spine. In today's video, we're going to go over medial tibial stress syndrome, better known as shin splints. This condition typically presents as exercise-induced pain over the lower 1/3 of the inside or medial portion of the lower leg, over the tibia, which is the larger of the two bones. So some important criteria are the pain should be 5 centimeters consecutively or greater, the quality of pain should be dull and achy, the pain should be reproducible with palpation or pressing on the area, and the pain should be during exercise or right afterwards. So there are two other conditions that can present somewhat similarly that need to be ruled out, stress fractures and compartment syndrome, which we'll cover next. So stress fractures. This area should be less than 5 centimeters. There may be a history of previous injury to the leg, and the pain will be more sharp and stabby or hairline, and there may be a medical history of osteopenia or osteoporosis. The other one is posterior exertion compartment syndrome. Now this typically has cramping, burning, numbness, or pins and needles in the posterior or back side of the calf, as well as some swelling. So if this is there, this is a medical emergency and needs to be referred immediately. So next we're going to go over some great exercises that can help with this to increase the capacity of both the soleus muscle, the calf muscle, the whole kinetic chain, so the whole leg, as well as increase the capacity of the bone. So the step up, we're going to get a small box or ledge and you're going to step up with one leg and then bring the other one down and then alternate. When doing this, we're trying to emphasize the legs and not the back, so make sure to keep an upright torso and not lean forward as you do it. You may need to adjust the level or the height of the box or the bench to your current fitness level, and then you may need to add weight as tolerated to increase the intensity of the exercise. We'll do about 8 here, and we recommend that you start with about 2 sets of 8 to 12 reps. Now we're going to go over the hip hike. So you're going to stand on a ledge so one leg is hanging off. Trying to keep the stance knee as straight as possible. You're going to drop that hip down to the floor and come up using your glute. So think of it as kind of a leg raise, but your leg is fixed and you're moving your body around your leg. Now you may need to start with your leg kind of tilted down and then bring it up to kind of get the movement because it can be awkward the first time. But you should feel tension over your lateral hip and you want to minimize knee bending. However, it will bend some. Now do the opposite leg. The same reps and set schemes applies. Again, trying to emphasize the lateral hip and minimize any bending of your knee, as well as trying to keep a flat neutral foot on the ground and increase range of motion as tolerated. So now for the soleus hip raise, you're going to need a small step up, and it's important to put only half your foot on there so your heel is hanging off. You're going to lay on your back, scoot your buttocks close to the step up, and then lifting the other leg up, you're going to drive up with your hip towards the ceiling. Now you want to emphasize the glute and the calf and not the back. If you feel it in your back, you may need to adjust your position, or if it's too challenging, you can start with a double-legged version and then progress as needed to the single leg. But again, when you're doing this, you want to feel it in your glute and your hip and your soleus or your calf muscle, not your back. So now do the opposite side. Lift the one leg that you just did off. Make sure that the heel is off the step up and just your toes are on, driving up with your glutes. Now this is kind of challenging, so you may want to start with 2 sets of 6 to 8 reps and then progress as tolerated. And again, if it's too challenging, you can just do the double leg version or reduce your range of motion. We'll do about 8 in this position. We recommend 2-3 sets of 8 to 12 reps and progress as needed. So the sideline lateral raise. So we're going to lay on our side and we're going to lift our upper leg up towards the ceiling and down, emphasizing our glute or our posterior buttocks. Now it's important to keep your leg back in line with your spine and not letting it come forward. Again, if it's too challenging, you can decrease the range of motion or bend your knee a little bit to decrease the lever arm and make it easier and then progress as tolerated. We recommend 2-3 sets of 10 to 12 reps and adding a pause at top to make it more challenging. Second down and making sure you get the full range of motion. Now initially you may need to limit this due to tolerance of pain, and that's fine, but over time increase the full range of motion. And what you can do as you get stronger is you can progress to one-legged version, or you can add a weight in your hands and do several reps. Now we'll do the soleus squat. So you're going to have your back against the wall and we're going to drop our hips down to where you feel a good tension, and then you're going to lift your heels off the floor with all the pressure on your toes. And we're going to try to hold this for 10 to 20 seconds or to your current tolerance. And then you'll repeat this for 2 to 3 sets. And again, as you get stronger, you can work on going lower with your hips and increasing the depth. So now we need to briefly discuss relative rest or load management. And this basically just means doing less to let the tissues calm down. This is an overuse injury, so just adding more exercises is probably not going to be successful. So the best way to do this is changing the frequency, the type, the intensity, or the duration that you're exercising. So how this might look practically is if you're running 3 times a week, you run twice a week. Or maybe you run 20 minutes instead of 40 minutes. Or maybe you run only once and then cycle twice for a temporary amount of time as the tissue calms down and then gradually increasing over time. So some risk factors for this condition are being female, an increase in BMI or weight, a previous history of this condition, increased use of orthotics, or just initiating running. So some training areas to be aware of is increasing the mileage, the duration, or the intensity of running too fast for your current level of fitness, having poor shoes, or running too much on hard or uneven surfaces. So hopefully you found this video helpful. By using all the different things we discussed in this video, you should be able to find a way to kind of manage the load as well as increasing the capacity and getting you back to running at your level. If you did find this helpful, please like the video and subscribe to our channel and turn on notifications.